Tom is about as touchy-feely as a steel screw. You know, that's not who he is. What he is thoughtful about, well, how can we do this better? How can we make this less difficult to do and end up with the same outcome?
He's unconventional, creative, stubborn. But I think it takes the stubbornness to be successful in this business.
The first time I met him, he was walking down the hall with some engineers. He was saying, you know, something about the design. You must, you know, something, you know, really being adamant about something. He was always able to bring this observational candor that other people were either afraid to say or didn't say.
He was a great one to stick his tongue out or flip you the bird. He didn't really care what you thought. If he thought it was funny, then it was funny.
He is curious. His curiosity rubs off on you, and he is constantly trying to delve in and solve problems.
I want to make this better, and I think I can, and so I'm just going to. That, I think, really drove him. I think it was actually quite innate and quite simple in that way.
He's had to fight all his life for what he has. So behind this brilliant engineering brain that relates to clinical problems is a very tough cowboy. Tom was the son of a gentleman who was an alcoholic and died at age 44 of colon cancer. His mother raised him, and even his mother didn't think that he would end up going to college because he wanted to be a boxer. He got a job with a guy named Cranley, who was a vascular surgeon in Cincinnati. He started scrubbing for Dr. Cranley.
But they were doing work together on issues within the legs, and first surgery was to go in, cut down the vessel, you remove the clot. And you know, the idea was that you solve the problem. Second surgery was to go and repair the damage that you'd done. The third surgery was an amputation.
Tom is an intuitive genius. I mean, he's not a trained engineer. He just is intuitively brilliant person about these kinds of mechanical things. He recognized that this was a bad way to do this, and there must be a better way. And he took a surgical glove, cut the tip of the finger off of it, put a pipe on the end of it, a flexible pipe, tied the surgical glove on, and he realized that if you blew that balloon up that represented the tip of the surgical glove, that you could insert that into somebody's femoral artery, run it up to above where the clot was, and as you blew up the balloon and pulled down, the clot that was stuck in the aorta would come down out of the femoral artery.
I think he's 19 or something at this age, right? Uses fly fishing technique to tie that tip of this catheter, you know, basically he's creating a balloon.
Tom made this catheter and beautifully removed this clot from this patient. And the famous quote was, "Holy shit, this really works."
It was a remarkable solution that led to an entire industry of minimally invasive surgery.
He was the right guy. This was the right place here in the Silicon Valley where there was wealth and there was innovative ideas going on. You know, he left Cincinnati to come out here, and then he realized this was the spot.
He would do surgery in the morning, he would come to the office, then he would go to the lab with the engineers, and then, you know, walk to his venture capital office to see what was worth investing in.
Didn't give a shit about, you know, talking to the other board members, didn't care about talking to management. He wanted to go and talk to the guys and girls doing the work.
Tom has an amazing way of characterizing a clinical problem and how the engineers should approach the problem. Because he did such a great job of describing the problem, the engineers could translate that very effectively into a product that addressed the needs extremely well. When the product launched, it grew to, I think it was well over $150 million the first year of launch, and took 80% market share that first year.
Tom demonstrated success. He made things happen. He was constantly approaching me with new ideas that he had about, hey, this is going to be big. Hey, you should watch this one. And he did it with always the patient at the center of the universe.
That's what Tom was great at. He figured devices that could simplify the way a procedure was done so that it was less traumatic for the patient and required less of the surgeon to get it done.
Just do it. he'd say, just do it. And that was this drive that he had. And I believe it was very much tied to the patient outcomes and what he'd seen over the years.
It's not just making a device that works, it's then testing it so thoroughly that you're willing to put it into humans. It's getting it through the regulatory process, it's getting it reimbursed, it's getting it financed. All of these elements require that same approach of dogged determination and creative problem solving that gets you through those hurdles. And I think that Tom's just a model of that.
I bring experience, but I don't bring new knowledge. There are things that are easier to do because they have been trained to do it or know how to do it. And so you pick up from them a lot. I learn a lot from my mentees, and it brings value to me. It brings value to our efforts to help patients.
I noticed at a point that he was less interested in spinning out companies, and he was more interested in the process of innovation, of mentoring. He really turned his attention towards how can this be sustainable.
Fogarty Innovation really has evolved dramatically over the years. Initially, Tom thought that it would be a way that we could help teach entrepreneurs how to bring their products forward and facilitate innovation. The vision has grown much broader over the years, and that is, how do we facilitate the ecosystem?
Our whole goal here is to accelerate the invention, development, and deployment of new technology into clinical practice. We want to focus on helping those innovators become better at what they do, so the next time around they have a better chance of success. And it is, I think, birthed a remarkable organization.
He is extremely tenacious, and when he believes in something, he will continue to iterate and continue to drive something forward that he really believes in.
Always curious, always wondering why, never accepting the easy answer. I think there's a generation of innovators that were sincerely touched by Tom's presence, Tom's work, and Tom's attitude.
Those are things, I hope I can bring to my board role here. Just let's not forget what it really takes to do what we're doing.
As gruff as he is on the outside, he's got a heart of gold, and he really likes to see others succeed.
Tom, I hope you know that you changed my life in so many ways. You very much appreciated me for who I am, not what I needed to become. And that was a transformational experience for me.
There's not that many folks who can invent new technology, have a winery, start a foundation up like us here, and then have the impact on so many people. He is just a kid from Cincinnati to this day.
When you think of the people that he has trained, surgeons, entrepreneurs, inventors, beyond that, Tom's quite the champion.